Gosling for ovarian protection during breast cancer adjuvant chemotherapy. Goserelin is a parental synthetic analog of luteinizante hormone releasing hormone used for the palliative treatment of advanced carcinoma of advanced breast cancer. Researchers have found that young women with breast cancer were able to preserve fertility during treatment of cancer with a blocking hormones injectable drugs causing then temporary menopause. The women who received the injection had only about a third of likely to have ovarian failure, a long-term frequent chemotherapy toxicity, and almost twice as likely to have a normal pregnancy after treatment of cancer, compared to women who did not receive injections in the study. In the study, women in premenopausal stage with breast cancer with hormonal receptors negative, with age between 18 and 49 years old, were assigned randomly to receive conventional chemotherapy with or without Goserelin every 4 weeks. Goserelin is a drug that alters the body hormonal feedback system, which has resulted in the reduction of the production of estrogen, which causes chemical menopause in women. The research compared the rate of ovarian insufficiency of women 2 years after having entered into the study and found that 22% of the patients who received the standard treatment had ovarian insufficiency, 50 of 69 patients, compared to 8% of those who had also received treatment with Goserelin, 5 of 66 patients. Of 200 patients enrolled in the study, 12 women of standard treatment were able to become pregnant compared with 22 patients in treatment with Goserelin. The conventional approach to preserve fertility in young women with cancer is to collect and preserve ovarian tissue, follicles, and embryos prior to cancer treatment. Find a simple and affordable way to protecting fertility in young patients with breast cancer without affecting the result of the treatment of cancer.
It's good news for young women who have had breast cancer treatment and still want a baby. A medication called Goserelin may help prevent the ovarian failure often caused by chemotherapy. I'm Shelby Cullinan with your latest health news. Women treated with Goserelin were also more likely to become pregnant after chemotherapy than women who did not receive this medication. Goserelin helps protect the ovaries, which are vulnerable to the effects of chemotherapy. Goserelin may also improve overall survival rates for women with breast cancer. The research team cautioned that although the findings are promising, further research is necessary. Speak to your doctor about different medication options.
Zoladex is a luteinizing hormone-releasing hormone analog, or LHRHA, that is used in the treatment of prostate cancer, pre- and perimenopausal breast cancer, and in the hormonal management of endometriosis. It's a depot formulation administered by a ready-to-use sterile syringe. Zoladex is delivered by the Safe System syringe, which is designed to reduce your risk of needle stick injuries. This program will introduce you to the Zoladex Safe System and demonstrate the recommended administration technique. SHARPs can present a significant hazard to healthcare workers, exposing you to the risk of contracting serious blood-borne infections. To help reduce this risk, many provinces have mandated the use of safety-engineered needles in hospitals and healthcare workplaces through their Health and Safety Act. Zoladex Safe System meets the requirements for a properly designed needle safety device, helping you feel confident and more protected from the potential risks of needle stick injuries. After use, the needle is completely protected, helping to reduce your risk of needle stick injury. Administration is straightforward. Ensure the patient is in a comfortable position with the area of the anterior abdominal wall below the navel exposed. Prepare the site for injection using aseptic technique. Remove the Safe System syringe from the pouch and ensure that the depot is visible by holding the syringe at a slight angle to the light. Remember, the depot is not a liquid, so you don't need to remove air from the syringe. Grasp the plastic retaining clip, peel it away sideways from the syringe, and discard it. Remove the needle cover. Pinch the patient's skin in the abdominal wall below the navel line, ready to inject at an angle between 30 degrees and 45 degrees. Hold the syringe around the barrel, and with the opening of the needle facing upwards, and with the needle held at the correct angle to the skin, insert it until the barrel touches the skin. The needle will be resting in subcutaneous tissue. To deliver the depot and activate the protective sleeve, press the plunger down fully until you cannot depress it any further. You may hear a click at this point. If the plunger is not depressed fully, the protective sleeve will not activate. Remove the needle completely and allow the protective sleeve to fully cover it. The sleeve will now be locked in position, protecting the needle. And dispose of the device in the normal way.